Now we'll look at the field of health promotion and behavior, where we have the challenge of changing people's lifestyles to improve their health. We're going to go to Dr. Jessica Molenberg in the Department of Health Promotion and Behavior at the College of Public Health here at the University of Georgia. Okay, Jessica, what are some of the different behavioral techniques that people can use to quit smoking?
Well, as you do know, it is very hard to change behaviors. People know smoking kills them and they continue to smoke. So what we try to do is say, why don't you replace the unhealthy behavior with a more healthy behavior? So if you do have the urge to smoke, maybe chew some gum, chew some sunflower seeds, chew on a straw, anything to get past that wanting the desire to have a cigarette. Also, exercise, get family support, reward yourself. So different ways in order to get past the desire to have the cigarette.
I feel like I'm chewing on sunflower seeds now. We remember those old black and white movies where it was undeniable that it was debonair and sexy to smoke cigarettes. Well, times have changed now. How acceptable is smoking now?
Well, you may not be able to live where you would like if you have a landlord that doesn't allow smoking. You may not get the job that you want. There are places that do not allow smokers to be hired at their place of business. You also may not be able to date who you want to date. A lot of people don't want to be with smokers.
Well, that's pretty convincing there. I think somebody watching this could be convinced. What would you tell them? What steps do they take to quit smoking?
They really want to start identifying as a non-smoker. And if there are any habits that they have that make them want to smoke, stop the habits. Just say, I'm going to replace that. Again, we're all about replacement with healthy behavior. You want to set a quit date. You want to tell your families and friends that you're going to quit smoking. And you really want to be in a program. We have a Nicotine Anonymous program across the nation. We do have places in Athens that offer Nicotine Anonymous. It is a drug. It's as addictive as heroin and cocaine. So we really need to start treating it as that. If the amount of people died in their 20s and 30s of smoking-related illnesses that are dying in later life, we would be outraged.
Okay. Again, I'm convinced. But what if I get started and I relapse? What now?
Well, most people do relapse. It takes quite a few times to quit smoking. Just keep trying. Only 5% can quit smoking without some type of behavioral intervention. So you really do want to get in a support program.
Well, what if I have a loved one that I want to quit? My parents both smoked and died of smoking-related illnesses. My mom smoked for 69 years and she still quit. How do you get a loved one to stop?
You tell them, and then a lot of people are motivated to do what their loved ones think is right. And that a lot of times, as long as they know they have the support and you can help them by, again, replacing those behaviors, then somebody has a much better chance to quit.
Okay, well, thank you, Jessica. We certainly can see now the importance of the field of health promotion and behavior.
Thank you, Chan.
Now it's time to look at the impact of health policy and management on public health. And to do that, we'll go to our series co-host, Dr. Phaedra Corso, who's head of the Department of Health Policy and Management here at the University of Georgia. Okay, Phaedra, what are some typical health policies that have been developed for tobacco prevention and control?
Well, policies can happen at the national, state, or local level, but here in the U.S., we've really been most successful at the state level in changing tobacco behavior.
Well, let's start at the national level then.
At the national level, we have labeling requirements for our tobacco products from the Surgeon General that talk about the harmful products in tobacco. We also have restrictions on tobacco campaigns, particularly around campaigns that would be targeting children. And then probably most importantly, for impacting the age by which you can purchase cigarettes, is federal monies that are only guaranteed to states if they pass laws that says you have to be over the age of 18 before you can purchase cigarettes.
Yeah, well, what are some typical state-level policies, that reduce smoking?
There are basically three important state-level policies around tobacco. The first one being is how much do states actually put into health education campaigns to prevent children and young adults from starting to smoke and then to get people to stop smoking. The second one is setting up bans or creating bans from smoking in certain public and private places. And the third one, which a lot of people have a particular interest in, is setting taxes on tobacco products.
Well, how does Georgia compare with these policies?
Well, Georgia's not doing that badly. In 2005, we passed the Georgia Smoke-Free Air Act, and this act set up certain bans for smoking in restaurants and bars. Although there are still some important exemptions to that law, one of them being is that if you have outdoor patio seating, you can still smoke in those areas.
Are there any improvements that you'd like to see or we could see in the state of Georgia?
Well, certainly the one area that we could improve on is the taxes. I know nobody likes to pay taxes, but the truth is that Georgia's tax on tobacco products, which right now is about 37 cents per pack of cigarettes, is one of the lowest in the country that has a national average of $1.45.
So, Georgia is the bargain basement of taxation on cigarettes.
Absolutely, and there's lots of room for us to grow in this area. There's economic evidence that shows that for every 10% increase in the price of cigarettes, consumption decreases by 4%. So not only can you raise state revenue by increasing the taxes, but you can actually decrease behavior as well.
Okay, well, thank you, Phaedra. That really gives us a handle on what kind of impact health policy management really has on the outcome in public health, particularly in this topic of smoking. The fifth and last area of public health that we'll cover is environmental health science. And to look into this, we're going to go to Dr. Luke Nair. Luke's a faculty member here in the College of Public Health in the Department of Environmental Health Science. And Luke, I wanted to start off with a discussion of secondary smoke inhalation, the people around the smoker. They're not smoking themselves, but they have some risk there, don't they?
Sure. Cham, in 2006, the Surgeon General issued a report that clearly and pretty well outlines the health risks of secondhand smoke in adults and in children. And there's been quite a bit of legislation over the last several years to ban smoking in environments to reduce secondhand smoke exposure. So that's a very important public health risk that's fairly well characterized.
Okay, well, I'd like for you also now to extend on that and talk about environmental sampling, a big feature that environmental health science lends to public health, and how the work that you're doing that with secondary smoke inhalation.
Sure. In 2005 in Athens, Georgia, where the University of Georgia is, we had a very good natural experiment. They banned indoor smoking in bars and restaurants. And working with students, we did some very simple studies using environmental tools to measure smoke as a proxy for secondhand smoke. Outdoor settings where these newly created exposure environments after the bans. And we've built on that work in the last few years, expanding it from environmental monitoring to include biological sampling of proxies or specific to secondhand smoke, and are starting a study this fall semester to expand that to look at environmental monitoring, biological monitoring, but also biological monitoring of effects related to secondhand smoke.
Well, one of the aspects of public health is the international work that we do. And I know that you've been involved in this extensively. I'd like you to tell us about that that international work having to do with stoves and how they are such a significant contributor to public health issues.
Sure, Cham. This idea of secondhand smoke and low exposures and human health, it's an interesting transition to go from that to the developing world, where we have a very similar exposure in chemistry, 4,000 or so chemicals, 50 or so carcinogens, but instead of from secondhand smoke, it's from combustion of biomass, wood, crop residue, dung. And we see exposures to vulnerable populations, pregnant women, young children, in up to 40% of the developing world. So very important exposures, very good public health question that involves environmental health, health promotion and behavior, epidemiology, statistics, nutrition, medicine, engineering, economists. But yes, very important exposure that translates into a bigger global picture.
I really appreciate that wrapping all that up for us, Luke, because that is indeed the heart of public health, is these different fields working together to achieve the goal of improving the health of the public. So I'm back with my co-host, Phaedra Corso, and to wrap up this series on public health impact. And I have to ask you, Phaedra, I mean, what's the impact on public health?
Well, I think this episode showed that tobacco really has a substantial impact on individuals and on communities. And I'll tell you, Cham, in my own life, I mean, I had a father who died from lung cancer 10 years ago, and so this was really meaningful to learn about how to prevent these types of things from happening.
Well, I have to tell you that we didn't know that when we were made co-hosts of this series, but my father also died of lung cancer about 15 years ago. And my mother died of chronic obstructive pulmonary disease as well from smoking. So it is, public health impacts on all of us.
Well, we have some great episodes coming up in the next couple of months. The first one being an exploration into emergency management. And in that episode, I'll be interviewing Cham and his colleagues at the Institute of Health Management and Mass Destruction Defense.
And after that, we'll do programs on violence and its impact on public health, and on aging, the aging population, the rapidly aging population.
Another session that we have planned is on healthcare reform. As you know, Cham, healthcare reform passed earlier this year, and a lot of people think that's the end of the discussion of healthcare reform, but in fact, it's just the beginning. So we'll have some experts in where we talk about what to expect for healthcare in the next couple of years.
Okay, Phaedra, we'll also have episodes on obesity, sexually transmitted diseases, and cancer, as well as many other topics.
In each of these fields, we'll be bringing in subject matter experts from our College of Public Health who will be talking about how there's a public health impact in our community.
So look for that in the TV guide and join us for Public Health Impact.